Hello, my name is Gage Primar with Primar Physical Therapy in Prescott, Arizona. Today I want to share with you a simple way to reduce low back pain. This simple tip has been shown to reduce low back pain over the long term, and it was actually studied in people with chronic low back pain, which is oftentimes a hard population to treat because their pain hangs on. This is a super simple technique that anybody can do. There is no equipment required, and it is a proven way to reduce low back pain. The premise of this technique is that when you first wake up in the morning, the discs in between your vertebrae have more fluid in them. Because there's more fluid in them, there's more pressure pushing out against the outside of the disc, and this can result in pain. Now, when you first wake up in the morning, if you bend forward, there's going to be even more pressure against the back part of the disc. And you're starting with more pressure because there's more fluid in the disc first thing in the morning. So this technique, all it does is limits lumbar or low back flexion first thing in the morning. This has been shown over the long term to reduce low back pain. People with chronic low back pain who eliminate lumbar flexion or bending forward first thing in the morning have less low back pain, use less pain medication, have less missed days off work because of low back pain, and have less low back pain related disability. And even at 3-year follow-up, individuals that continue to eliminate lumbar flexion in the morning continue to have less pain and less pain related disability. So anybody can do this. All you have to do the first hour after you wake up, for the first hour, you want to avoid lumbar flexion. Lumbar flexion is simply bending forward. So when you bend forward like this and your back rounds out, that's lumbar flexion. So you're probably thinking, well, yeah, I have to sit on the toilet, I need to brush my teeth, I need to bend forward and tie my shoes. This is true, but you can do those things without lumbar flexion. The key is bending through the hips, not the spine. So from a side view, if you were bending forward, you would bend like this, keep your back arched, bend through the hips, opposed to bending like this and rounding your back. When you sit down, you want to sit and bend through the hips, opposed to through the lumbar spine. My patients, I tell them, when you wake up in the morning, don't go sit down and eat breakfast. Stay in a standing position and eat breakfast. When you sit down on the toilet, hinge at the hips, don't round out your back. When you go to tie your shoes, hinge at the hips, don't round out your back. It's really effective though if you just do things from a standing position when you first wake up for that first hour, opposed to a sitting position. That eliminates most of the lumbar flexion in the morning. That's all it is. Very simple, but very effective even in people with chronic low back pain. And as we mentioned, this has been studied over a long period in people with low back pain and has been shown effective to reduce pain over the long term. So avoid lumbar flexion or rounding out your back for the first hour in the morning, and I know you will notice less low back pain and you will be happy with that. If you still have problems with low back pain, click on the link below or call us at Primar Physical Therapy and we'll help you out. Thank you.